NORCET Marathon MCQs. Which electrolyte is the major cation in extracellular fluid ECF? Sodium. Normal adult respiratory rate is 12 to 20 per minute. The normal pH of arterial blood is 7.35 to 7.45. The antidote for heparin is protamine sulfate. Which vitamin deficiency causes scurvy? Vitamin C. The first heart sound S1 is produced by the closure of mitral and tricuspid valves. The Glasgow Coma Scale GCS maximum score is 15. The most common site for intramuscular injection in adults is ventrogluteal. BCG vaccine is given to prevent tuberculosis. Which cranial nerve is responsible for vision? Optic nerve second. Normal adult pulse rate is (60 to 100 per minute). Which chamber of the heart has the thickest wall? Left ventricle. Insulin is secreted by beta cells. The functional unit of the kidney is nephron. Which blood group is called the universal donor? The normal body temperature is 37 degrees Celsius. Which vitamin helps in blood clotting? Vitamin K. The strongest bone in the human body is femur. Which instrument is used to measure blood pressure? Sphygmomanometer. Which vaccine is given at birth? BCG. Normal platelet count is 1.5 to 4 lakh per cubic millimeter. The largest organ of the body is skin. Which disease is caused by insulin deficiency? Diabetes mellitus. The normal hemoglobin level in adult females is approximately 12 to 16 grams per deciliter. The antidote for opioid overdose is naloxone. Which cranial nerve controls facial expression? Facial 7. The normal oxygen saturation, SpO2, is (95 to 100%). Which electrolyte is mainly intracellular? Potassium. K. CKPR should begin with chest compressions. Which vitamin is synthesized in the skin by sunlight? Vitamin D. The normal adult urine output per day is 1,000 to 2,000 milliliters. Which artery is commonly used to check the pulse? Radial artery. Which valve lies between the left atrium and left ventricle? Mitral valve. The incubation period of chickenpox is 10 to 21 days. Which hormone regulates calcium levels in blood? Parathyroid hormone. Which blood vessel carries oxygenated blood from the lungs to the heart? Pulmonary vein. The normal white blood cell count is 4,000 to 11,000 per cubic millimeter. Which vitamin deficiency causes night blindness? Vitamin A. The main function of red blood cells is oxygen transport. Which organ produces bile? Liver. Which route gives the fastest drug action? Intravenous. The normal fasting blood glucose level is 70 to 99 mg DL. Which microorganism causes tuberculosis? Mycobacterium tuberculosis. Which part of the brain controls balance and coordination? Cerebellum. Which electrolyte is important for muscle contraction? Calcium. The normal ECG wave represents atrial depolarization. Which injection angle is used for intramuscular injection? (90°). Which disease is prevented by the hepatitis B vaccine? Hepatitis B. Which electrolyte imbalance commonly causes cardiac arrhythmias? Potassium imbalance. The first priority in emergency patient assessment is airway.